Welcome to Akrivis Laboratory, a place where every corner hums with precision and every instrument tells a story. Here, science comes alive. Microscope reveal what the eye cannot see, PCR machines decode hidden genetic messages, and incubators nurture life to deliver accurate results. Walking through Archivist is like entering a living puzzle of discovery. Every test, every workflow, every tool works together to reveal answers that matter. It's more than a laboratory. It's a hub of innovation, accuracy, and patient-centered care, where each result is a step toward better health and understanding. Akrivis Laboratory, a tertiary clinical laboratory dedicated to delivering comprehensive and specialized diagnostic services that support the accurate detection, diagnosis, and treatment of a wide range of diseases. The name Akrivis is derived from the Greek word akrivis, which means precise and accurate. Being a privately owned and freestanding facility, Akrivis Laboratory operates independently from government institutions and hospitals, which allows for greater adaptability, operational efficiency, and prompt responsiveness to the needs of patients and healthcare providers. This independence also enables the laboratory to maintain focus on excellence in every aspect of diagnostic services, ensuring that patients and healthcare partners receive timely, accurate, and reliable results. With advanced technology, skilled professionals, and stringent quality assurance measures, Akrivis Laboratory is prepared to meet even the most demanding diagnostic needs. The name Akrivis from the Greek word akrivis, which means precise and accurate. This name represents the laboratory's dedication to careful and exact testing in every procedure. It reminds the staff to maintain high standards in all operations, from analyzing samples to ensuring quality, so that every result is reliable and can be trusted by patients and healthcare providers. The mission of Akrivis Laboratory is deeply connected to the meaning of its name, to uphold the highest standard of the laboratory practice by delivering precise and accurate results. The laboratory continuously improves its processes to ensure timely, reliable, and high-quality patient outcomes, utilizing advanced technologies and the expertise of highly trained professionals. Through these efforts, Akrivis Laboratory fosters trust and confidence among patients, physicians, and partner institutions, embodying the principle of accuracy that its name represents. The vision of laboratory is to be recognized as a center of excellence in clinical diagnostics. It aims to establish the benchmark for quality, accuracy, and precision, reflecting the meaning of its name, Akrivis, or precise and accurate, and setting a standard for other laboratories to follow. By striving for innovation, leadership, and patient-centered services, Akrivis Laboratory seeks not only to excel in diagnostic capabilities but also to serve as a model for excellence in the healthcare community, ensuring that the principle of precision guides both its present operations and future goals.
Presented is the organizational chart of the laboratory. An organizational chart shows the hierarchy and roles inside the laboratory. It helps clarify responsibilities, reporting lines, and workflow across departments. On the topmost part is the laboratory director, who oversees all lab operations. Under the laboratory director are the clinical pathologist, who interprets clinical laboratory results, and atomic pathologists, who focuses on tissues and organs. Following them is the chief medical technologist, along with the assistant chief medical technologist, who supervise daily lab workflow. Under the chief medtech are the section heads, who are responsible for each section in the laboratory. Each section has its own medical technologist, who is supervised by the chief medtech. Also under the chief medical technologist are the support and utility staff too, such as facility and waste supervisor. Under them are the laboratory aides or attendants. Next is the reagent preparation supervisor, who is then followed by the medical laboratory technician. Next are the LIS or Laboratory Information System Administrator, and under them is the IT staff who maintains lab systems. Next are the Biosafety and Quality Assurance Officers who ensures lab safety and accuracy of results. Lastly, the Support Services Supervisor who oversees the utility and maintenance staff, clerks, inventory staff, and laboratory managers.
Today, I will be presenting the major sections of the clinical laboratory, along with the essential equipment used in each area. These instruments support accurate testing, reliable diagnosis, and safe laboratory practice. Let us begin with clinical microscopy, one of the most fundamental components of a diagnostic laboratory. According to the Lung Center of the Philippines, this section involves the physical, chemical, and microscopic analysis of non-blood body fluids. These include urinalysis, fecalysis, fecal occult blood testing, semen analysis, pregnancy testing, and the examination of fluids such as cerebrospinal, synovial, pleural, and peritoneal fluids. The equipment used in this section includes microscope, strip reader, urine analyzer, hematocytometer, clinical centrifuge, refrigerator for reagent and sample storage, and waste bin for safe disposal. Next is clinical chemistry, the section responsible for analyzing biochemical substances in the body. According to the Medical College of Wisconsin 2025, this area measures analytes in serum and plasma, including glucose, lipids, creatinine, BUN, uric acid, electrolytes, ALT, AST, and other chemical components. Equipment used in clinical chemistry includes chemistry analyzer, spectrophotometer, clinical and microcentrifuges, water bath, incubator, drying oven, electric, gas, or stove, refrigerator, and computers. The hematology section focuses on the study of blood and blood-forming organs. According to the American Cancer Society 2025, this section analyzes hemoglobin levels, hematocrit, red and white blood cell counts, platelet counts, and provides complete blood counts crucial for evaluating conditions such as anemia and infections. Its primary equipment includes hematology analyzer, microscope, hematocrit centrifuge, hematocrit reader, pipette shaker, microcentrifuge, refrigerator, waste bin, and computer set. The next major area is immunohematology, also known as blood banking. According to the International Society of Blood Transfusion 2025, this section studies reactions between antigens and antibodies to ensure safe and compatible blood transfusions. It performs ABO and RH typing, cross-matching, and antibody identification. Equipment used in the blood bank includes automated blood bank system, centrifuge, gel card centrifuge, RH viewer, tube sealer, plasma extractor, refrigerator for blood storage, backdraft table, and microscope when needed. Immunology serology integrates immune system analysis and serum-based testing. According to Johns Hopkins Medicine 2004, immunology studies immune functions while serology detects antibodies, antigens, and infectious markers. Tests include ASO, RPR, dengue NS1, HIV, and hepatitis screening, tumor markers, and thyroid function tests. Equipment in this section includes microplate washer, microplate reader, ELISA washer set, bead system, CRP analyzer, incubator, refrigerator, microscope, and computer. Microbiology specializes in the identification of microorganisms such as bacteria, fungi, viruses, and parasites. According to Johns Hopkins Medicine 2025, this section performs gram staining, KRH tests, AFB staining, and culture insensitivity testing. Microbiology's essential equipment includes biosafety cabinet, isolation hood, microscope, incubator, autoclave for sterilization, clinical centrifuge, electric gas or stove, dry incubator, water bath, drying oven, refrigerator. Finally, we have histopathology and cytology, which fall under anatomic pathology. According to the Royal College of Pathologists 2021, histopathology examines tissues to diagnose diseases, while cytology studies diseases at the cellular level. Common tests include pap smears, frozen sections, immunohistochemistry, autopsies, and tissue biopsies. Equipment used include Auto-Technicon tissue processor, microtome, paraffin oven, drying oven, microscope, water bath, backdrop table, and refrigerator.
A specimen flow is a structured, sequential process governing the movement and handling of a patient sample from the moment of collection to the final release of results, ensuring identification, processing, testing, storage, disposal, traceability, accuracy, and biosafety. It has three different components and includes the analytical phase, and post-analytical phase. In a tertiary laboratory setting, its importance is paramount because it acts as a critical quality assurance system. A rigorous, standardized flow minimizes the high rate of pre-analytical errors, which according to Norden et al. 2024 accounts for the 60% to 70% of laboratory errors. It also supports diagnostic testing turnaround times and guarantees the integrity and accurate tracking of high volume, highly specialized specimens required for critical patient care. In the pre-analytical phase, it's all activity from the test request to the cell being ready for analysis. So it includes the activities such as test request, patient identification, specimen collection, immediate labeling, pre-transport handling, transport to laboratory, specimen receipt, logging, prioritization, and various specified pre-analytical processing for the different clinical settings. As seen at the PowerPoint presentation, we have the different steps for the pre-analytical phase of a laboratory. So for the first step, we have the test request or order, and this usually happens outside of the laboratory where a clinician submits a request and the required tests. So for the patient identification up to the pre-transport handling, this usually happens in the collection room. For the patient identification and preparation, this is where you confirm the patient's identity and ensure proper patient preparation. For the specimen collection, this is where you actually collect the sample, such as blood, urine, and other bodily fluids. So for the next one, this is important, the immediate labeling part. It is important that you label the specimen at the point of collection with the patient's name or ID, date, time. This ensures that there's no errors to be done or there's no misplacement of the specimen. Then lastly, for the collection room, we have the pre-transport handling, and this is usually where specimens are prepared before they are transported to the clinical sections. So for the transportation or transport rather to the laboratory, it's usually done through transport system where the specimens are moved through the different clinical section for analysis. Then we have the specimen receipt. This is where laboratory personnel receive the sample and check its integrity, label readability, and ensure the requisition matches the specimen. So they confirm if everything is matched and accurate and correct. So for the logging part or accessioning, this is where they assign a unique accession number to the specimen and enter the specimen and test order into the laboratory information system or LIS for traceability. So LIS is very important for the laboratory. It has all the information of every test, every patient, every client that comes into the laboratory. Then we have the prioritization part where specimens are sorted by the test type and its urgency. So this is where STAT or emergency specimens has priority over routine. And it also includes any special requirements. So for the pre-analytical processes, this is where specimens are prepared for testing. For some tests, this involves centrifugation, aliquoting, dilution, or slide preparation, and of course, it depends on the clinical section that the specimen will be transferred into. Earlier, different clinical sections have their different and specified pre-analytical processes that have various methods and all have their own specimen requirements, analysis, and results. For the clinical chemistry, it involves the use of different colors of test tube for serum, plasma, and glucose tests. Serum and plasma samples must be clotted before centrifugation to prevent hemolysis. So that is for clinical chemistry. And it also utilizes centrifugation to separate serum or plasma from cells, and aliquoting is also used to distribute the sample to different chemistry analyzers. So that's for the clinical chemistry. Moving on, we have the clinical microscopy, involves the analysis of urine and other bodily fluid as its specimen. So for urine, it utilizes clean catch midstream to ensure that the specimen is clean and is usually centrifuged. Then for hematology, it uses whole blood specimens with no centrifugation. It also utilizes blood smears that must be prepared within 1 hour to prevent cell distortion. Next, we have the immunohematology, which also involves whole blood as its specimen. and double checking of patient ID and specimen label is strictly observed in this section. And a specified testing is called for. Blood is centrifuged to test serum or plasma. Next, we have the immunology or serology, and involves serum or plasma centrifugation to obtain its required specimen. Allocating may be needed for multiple tests. Microbiology involves diverse specimen preparation, including swabs, urine, bloods, and other fluids. Contamination must be avoided at all times, as these organisms or microorganisms rather are very sensitive and can spread and violate biosafety protocols. Then we also then it also rather includes process such as media preparation, plating, smears, and blood culture. Lastly, we have histopathology rather and cytopathology that involves the preparation of tissue and cell samples. This is where the samples are required to be processed immediately into their corresponding forms, such as paraffin, blocks or smear samples or as shown in the slide, analytical phase covers the actual testing of the specimen using instrument or manual methods. Its function is to produce accurate results through the strict adherence to validated procedure and rigorous quality control checks. Qualified personnel then verify and interpret the raw results before they are reported. So for the steps, they have the analytical testing and the quality control and the verification. Then we have the post-analytical phase that encompasses all activities after the test results are produced. It involves validating and entering results into the LIS, reporting findings to the clinician that includes urgent calls for critical values, and the long-term storage and final disposal of the biological specimen. This phase ensures clear communication, documentation, and traceability of all testing records as well as the improvement of laboratory services. Then we can see the different steps that will be discussed later. As for the analytical phase, it is similar with pre-analytical phase for every clinical section where it requires its own set of procedures to be carried out. So in clinical chemistry, it uses its set of automated high throughput chemistry analyzers to test the composition of fluids. Then for the clinical microscopy, this involves routine urine analysis where they perform physical, the color, clarity, chemical reagent strip, and microscopic or sediment analysis examination. It also has its semen analysis that must be tested within 30 to 60 minutes after collection. Then we have hematology that involves the complete blood count or CBC, platelet count done on automated hematology analyzers. It also has the erythrocyte sedimentation rate or ESR test that has the sample stable for 4 hours at room temperatures and 12 hours at refrigerated samples. Immunohematology has a process of blood typing and cross-matching methods as well as antibody screening and identification. Immunology serology utilizes various methodologies including ELISA, chemiluminescence, and immunochromatography. Microbiology is where cultures are incubated for growth and identified using automated systems or biochemical tests as well as antimicrobial susceptibility testing. Histopathology is where histology is done through paraffin blocks that are cut into thin sections, stained, and reviewed by a pathologist. It also involves cytology where smears or blocks are stained and screened by a cytotechnologist, then reviewed by a pathologist. Then, after the respective analytical testing of each specimen, it is also important to review the quality control results and repeat tests if necessary. A qualified personnel verifies and interprets the results with utmost care and expertise. The result entry and validation. And it usually occurs in the specific clinical section from where the results came from. These results are entered and undergo technical verification directly in the clinical section where the test was performed. Then we have the result reporting, and usually is done in the pathologist's office and the LIS terminal. The LIS terminal is the digital gateway for releasing reports, while the pathologist is included here as the legal required professional interpretation and sign off for many specialized tests. So they're like the verifiers of the test results. Then we have the storage and retention, and it is usually also located in the respective clinical section. So the specimens or the samples are stored in the clinical section or adjacent designated areas that allow for immediate add-on testing or troubleshooting before moving to disposal or long-term archiving. Then we have the fourth step, which is the disposal, and it's usually done in the laboratory disposal area or, or the waste holding area. So disposal area and waste holding are dedicated, secured physical spaces required for segregating, neutralizing, and safely accumulating biohazardous materials according to stringent biosafety regulations. So to the second to the last step, the documentation. This is usually done in the laboratory information or the laboratory information system rather, the LIS. So LIS has been mentioned before, and it is the central digital hub used to maintain permanent searchable and linked records, the accession number for example, for all aspects of the testing process, ensuring full legal traceability. So everything is documented in the LIS. Then for the last step of the post-analytical phase, we have the continuous improvement, and it's usually done by the laboratory management or the admin offices. Management and admin offices are the functional locations where the data, like error rates and turnaround times, is reviewed and where policies are developed, implemented, and audited to enhance quality and efficiency of laboratory services to better serve the people. That is all for the specimen flow. Alright. After getting to know the processes present in the Akrivis laboratory, let us now take a closer look at the laboratory itself by watching this walkthrough presentation.
After watching the walkthrough, let's now take a closer look at the design and the layout of the Akrivis laboratory, starting with the ground floor. As we watched, the entire laboratory is elevated or raised. This is not only used for visual appeal but is also functional. This is because raised floors help with cable management and maintaining optimal temperatures, which are essential for sensitive equipment. Because of this design, accessibility was also considered, so ramps are provided to make it easy for people that uses wheelchair or people with disabilities to navigate the space. Moving on, the ground floor is divided into three main areas: the business area, the clinical section, and the support services area. The business area is where patients interact with in the lab. This includes spaces for registration, waiting, and inquiries, ensuring that the patients have a comfortable and organized environment without interfering with the sterile laboratory workflow. Next is the clinical section, which is on this floor, focuses on the common tests such as clinical microscopy, hematology, and clinical chemistry. While additional clinical sections exist on the second floor, the ground floor handles most of the routine testing, keeping patients' access controlled and workflow efficient. Lastly is the support services area. Like the clinical section area, this also has its another section on the second floor, but on the ground floor is a smaller version of the main staff facilities upstairs. Its main purpose is to house the sterilization area for the clinical sections on this level, supporting smooth operations. Now, let's discuss the areas in each of these zones in more detail. First, in the business area is where we will find the reception and the waiting area. This too is located right at the main entrance. This placement keeps patients in a controlled space and reduces unnecessary traffic in technical areas. Administrative tasks such as registration, billing, and inquiries are handled here without affecting the laboratory workflow. Next is the pathologist's office, which is positioned outside the main laboratory section but close enough for the pathologist to quickly access the lab for supervision or result verification. This placement allows the pathologist to meet with other people without bringing non-lab personnel into the restricted areas, which helps maintain biosafety and confidentiality. Next is the specimen collection area, which is also located at the business area. This position or placement enables patients to submit samples such as blood without moving through the main laboratory, which reduces exposure to biohazard zones and keep the workflow smooth. Now, with regards with the toilets, this can be divided into two. First is the dedicated specimen collection toilet, which provides privacy for urine and stool samples following DOH standards. Then we also have the separate public toilet, which is available for all. This ensures that the traffic does not interfere with the specimen collection. There are also two key pass-through windows that help maintain safety and workflow in the lab. The first window is between the reception and the collection area. This allows forms, sample containers, or small items to be passed securely while minimizing the risk of contamination. The second window is between the collection area and the clinical section. This acts as a physical and biosafety barrier, allowing specimens to move deeper into the laboratory while patients remain outside. Together, these windows support a one-way workflow, preventing crowding and ensure that the patient-accessible areas remain separate from the controlled testing areas, reducing the risk of contamination and maintaining efficient laboratory operations. Near the pass-through window and now in the clinical section is the reagent preparation area. This is where chemical solutions, buffers, and other laboratory consumables are prepared and handled. Its location allows reagent to be distributed efficiently to other sections without staff walking through multiple areas, keeping the lab clean and minimizing contamination. And of course, since this is a two-story laboratory, we also cannot forget about a dumbwaiter lift, which helps move specimens safely between floors without manual handling. This also helps minimize the risk of contamination and minimizes the foot traffic. Next is the main analytical core section, which includes the hematology, clinical microscopy, clinical chemistry, immunology, serology, and immunohematology, which are all located near each other. This clustering is intentional and important because many of these sections handle similar specimen types, such as whole blood or serum, and often require sequential testing. Placing these sections near each other reduces transport time, minimizes the risk of specimen mix-ups, and facilitates smoother workflow for medical technologists who may rotate between these areas. Then, a shared hand washing stations and emergency safety fixtures are also conveniently located near these sections to reinforce biosafety practices. And lastly, for the ground floor is the support services area, which includes the sterilization and the waste management. Both of these are located near the service entry and exit door. This strategic placement allows contaminated materials such as used glasswares and biohazard waste to be removed safely without passing through a clean or patient-accessible areas. By keeping dirty and clean items separate, the laboratory maintains a clear clean to dirty workflow, which is essential for preventing contamination. Moving on to the second floor, this area is accessible via elevator and stairs present in the clinical section. This means that no patient can go to the second floor of the lab. The second floor, unlike the ground floor, is divided in just two major zones. First one is the clinical section, and then we also have again the support services area or the staff area. The second floor clinical section handles specialized tests and requires separation from the routine sections to prevent contamination, such as the microbiology. The second floor staff area provides lockers, changing rooms, bathrooms, and a pantry, allowing staff to rest or prepare without interrupting the laboratory workflow. Let's discuss this in detail. Okay, so for the first room, near the entrance are the administrative offices for all supervisors. These offices serve as a central point for monitoring laboratory operations. Supervisors can oversee staff performance, coordinate schedules, manage workflow, and respond to issues quickly. Being near the entrance allows them to observe both staff movement and specimen flow, ensuring efficiency and safety. Adjacent to this is the media preparation area, which is outside but close to the microbiology section. This area is used to prepare culture media in a controlled environment where media can be melted, sterilized, poured, and stored. Its separation from the main microbiology benches prevents accidental contamination, while its proximity allows technologists to transfer prepared media efficiently, supporting both workflow and biosafety guidelines. And of course, the microbiology section is placed in the second floor as an isolated area because it handles infectious agents that can produce aerosols. Its location reduces the risk of contamination spreading to other parts of the lab. Dedicated sterilization and decontamination rooms for microbiology also allows used culture plates, contaminated glassware, and biohazard materials to be safely sterilized and disposed of without crossing the clean zones. Biosafety and proximity to incubators further ensure safe handling of high-risk specimens. And for the last part of the clinical section is the histopathology section, which is also located in the second floor as an isolated zone because it handles hazardous chemicals like formalin, xylene, and paraffin. Its location away from the core diagnostic areas minimizes exposure to fumes and allows tissue processing activities to proceed safely. Finally, the staff supporting areas including the lockers, changing rooms, and pantry are placed along the periphery of the lab or near the service entry or exit. This ensures that the staff can access these areas without disrupting the laboratory workflow. Lockers positioned near the service entrance or the staff entrances rather helps enforce proper lab attire, reduce contamination risk, and maintain separation between clean and restricted zones. Altogether, Akrivis Laboratory did not just prioritize aesthetics, but also ensure that each location and each design has a benefit for the performance of the lab.
Safety and quality are integral to the operations of Archivist Laboratory.
Our commitment is not only to deliver accurate and reliable results, but also to ensure that every staff member works in a secure environment. Let me walk you through the built in safety measures that make it possible. Moving on for the built-in safety measures. These are engineering and structural features such as ventilation systems, emergency wash stations, and secured chemical storage designed to reduce hazards and maintain a safe working environment as per UP Manila. Akrivis Laboratory has the following built-in safety measures like fire safety, hazard signages, emergency stations, biological safety, chemical spillage containment, ventilation systems, waste disposal, and surveillance and biosecurity. We begin with hazard signages. Warning signs are placed in all areas and on materials that pose potential risk. These signs use clear symbols and color codes so staff can immediately recognize hazards and follow safety protocols. Fire safety is a top priority. Fire extinguishers, alarms, and automatic sprinklers are distributed across the facility. On the second floor, we have designated an exit and clear evacuation maps to guide staff during emergencies. Next is our emergency stations. Eye wash units, showers, and first aid kits are strategically installed in key sections of the laboratory. These stations allow for quick response to chemical splashes, biological exposures, or to minor injuries. For biological safety, infectious materials are handled only in biosafety cabinets. Sterile areas such as media preparation rooms, along with multiple hand washing stations, help maintain a contamination free environment. To address chemical risks, our walls, floors, and workstations are built in with chemical resistant materials like epoxy resin and stainless steel. Spill kits containing absorbents, neutralizers, and protective equipment are available in designated areas to ensure rapid containment. Our ventilation system combines general exhaust with fume hoods to maintain safe air circulation. Hazardous rooms are kept under negative pressure, while clean areas use positive pressure. Importantly, air is sourced and exhausted outside, preventing recirculation of contaminants. Waste disposal is carefully managed. Color coded bins and sharps containers are placed throughout the lab to ensure proper segregation. Waste storage areas are located away from the clinical sections to prevent cross contaminations. Finally, surveillance and biosecurity measures strengthen overall safety. CCTV cameras monitor key areas, while access control systems such as keycards restrict entry to authorized personnel only. In summary, Archivist Laboratory integrates safety and quality into every aspect of its operations. Through these built-in safety measures, we ensure both staff protection and consistent delivery of reliable laboratory results.
So now, let's move on to Standard Operating Procedure or SOP. What is SOP? All standard operating procedures implemented in the laboratory are developed based a combination of internationally recognized guidelines and Philippine regulatory standard. Locally, the University of the Philippines, Manila, says that SOP is a written instruction that emphasizes biosafety, chemical handling, and emergency preparedness tailored to clinical and academic settings. Not only that, SOPs are effective in promoting safety, operational consistency, and readiness for emergency. We have 15 SOPs that I will tackle one by one. So first one, we have the access control and visitor policy. Patients and visitors are limited to the specimen collection and reception areas. Only authorized personnel may enter offices within the laboratory, and visitors are not permitted to interfere with any analytical work. Why? For example, pumunta po yung patient sa clinical lab, nagpakuha siya ng dugo, and then yung pathology, kinuhanan siya ng dugo, tas yung after makuhanan ng dugo ni patient, sinabi ng pathologist na magstay siya doon. And hindi nakinig yung patient, tinry niyang sundan yung pathologist, and then napansin niya ng pathologist, tapos in-stop siya, sabi na huwag siyang aalis and bawal siyang pumasok doon. Why? Bakit siya in-stop? Kasi pwedeng at risk yung buhay niya, pwedeng ma-expose siya sa mga toxic chemicals and other infections or any infections na nandun sa lab na yon. Additionally, pwede ring makontaminate yung mga specimens na nandun sa lab na yon, kaya dapat yung mga professionals lang yung mga pumapasok doon, and hindi yung mga patients na walang alam about sa mga reagents or any chemicals na tinetest doon. Kasi nga, ayun, pwede silang mag-pose ng risk sa health nila, and also pwedeng ma-contaminate nga yung mga chemicals doon at saka yung mga specimens na nandun. So next, we have the emergency and contingency planning. So, laboratory heads will establish contingency plans and emergency, and all personnel must be informed and trained on these procedures. Why? To ensure the patient samples, equipment, and personnel remain safe during unexpected emergencies. And also, para ma-contain or magtuloy-tuloy pa rin yung mga procedure. For example, we have the unexpected power outbreak. Yung mga medical technologies, for example, is tinetest nila yung mga specimen, nire-record nila yung mga specimen, and then nagkaroon nga ng power outage. Tapos, syempre, ang contingency plan nila doon, since bawal nga na maiwan yung basta-basta yung mga specimen, kailangan nilang ilipat yon sa backup refrigerator para hindi siya makontaminate and para hindi masira yung mga test results. Next, we have the staff competency and training. The competency of all personnel will be continuously assessed, and staff will be provided with ongoing opportunities and professional development and training. It is to ensure and maintain reliable laboratory results that physicians depend on for diagnosis. Like for example, yung mga medtech po is nag-undergo sila yearly ng proficiency training sa CDC to confirm accuracy sa mga hematology results. So, sa ganun po, is napapractice po nila or lalo po nilang mapag-aaralan na kung paano kumuha or mag-test ng CDC for accurate results po. Also, yung importance din po ng mga staff competency and training is para masanay na sila, maging expert na sila, and then, syempre, pag naging ganun na po sila, nasanay na sila, naging expert na sila sa mga ginagawa nila, may ensure po yung mga reliable result, yung mga reliable testing result. Next, we have the inventory and reagent management. Adequate stocks of properly stored reagents and supplies must be maintained. Reagents nearing expiration must be used first. Bakit? Kasi for example po, naglagay kayo ng mga reagents dun sa storage room, and yung mga last na reagent or yung mga lumang reagent is na-push backward dun sa storage or sa storage shelf. So, yung mga bagong reagent yung nilagay niyo sa harap. So, kapag naubos na yung mga bagong reagent na nilagay nyo sa harap, hindi nyo na napansin na or nakalimutan nyo na yung pinakadulo na reagent is sira na. So, pag nangyari yun, pwede siyang pag nagamit nyo yun, pwede siyang bigay ng mga inaccurate results, or much worse, pwede siyang sumabog. So, next we have the Material Safety and Data Sheet or the MSDS. MSDS for all reagent will be complied and maintained by the Chief Medical Technologies and must be readily accessible at all times. Why? Ang importance po neto is to protect the staff from chemical accident and ensure safely handling of reagents. For example po, yung medtech, before using po yung formalin, kailangan niya munang i-read yung MSDS para maintindihan niya kung ano yung mga hazard na pwedeng mangyari sa kanya or mabigay nung pag ni-use niya yung formalin, at saka ano ba yung mga required na PPE para ma-lessen yung risk or yung hazard na mag-occur. Facility and equipment maintenance. Schedule maintenance of the laboratory including the cleaning, the ventilation, the electrical system, and also the structural facilities will be implemented and documented in the maintenance log. Why? It is to keep the lab equipment or the laboratory environment safe and prevents contamination of patient samples. Example, sa biosafety cabinet po or yung biosafety cabinet po is nag-undergo siya ng routine airflow para sa testing and cleaning every month. And yun nga, para ma-keep yung safety and mag-prevent ng contamination sa mga patient samples. For example, hindi mo nalinis yun. Mag-stay doon yung mga bacteria and then paano mo pwedeng pumasok yun, makontaminate yung mga bago mong specimen na kailangan mong itest, kailangan yung mga accurate, hindi na magiging accurate yung mga results mo kasi may mga lumang bacteria na yung pumasok doon sa bago mong tinetest kasi hindi mo nililinis. Now we move on to equipment calibration and record keeping. All equipment must be calibrated at least 6 months with maintenance and repair records properly documented. For example, yung chemistry analyzer po natin is kinakalibrate every 6 months and all calibration logs are recorded in the maintenance file. Bakit? Ano po yung importance niya? It is to ensure equipment procedures accurate, consistent, and trustworthy results. For example, pwede po nating ipasok dito yung facility and equipment maintenance. Sample nga po dun yung test tubes po natin. Pag nag-record keeping po tayo, kailangan pag naglilinis tayo, nire-record natin lahat yan para maging alam natin kung ano na ba yung mga nalinis natin, kung daily ba silang nalilinis or hindi, or kung daily ba silang tinitignan or chine-check up kung may sira pa o hindi. Kasi with the help of this record keeping po, nakikita natin kung kailangan na ba silang linisin, ano ba yung may sira, kung may sira ba sila, kailangan nilang palitan. So, ayun po, yung nagiging tulong ng equipment calibration and also yung record keeping. Next, yung mga laboratory data and record management. All laboratory records must be accurately logged. Digital records are managed through the Laboratory Information System or the LIS, while yung mga physical copies naman po are carefully stored. No information shall be shared without approval of the Chief Medical Technologies or other authorized personnel. For example, yung nag-test po, yung medtech is tinest niya si patient for a glucose test. And then, yung mga result po is nilalog niya din sa LIS and files the request form. Yung importance po nito is yung pinoprotect niya po yung yung patient information and also ine-ensure niya yung proper traceability of all laboratory agents or laboratory results. Next, we have the PPE or the personal protective equipment. Our laboratory personnel must wear appropriate PPE while inside the laboratory, which will be removed before leaving the laboratory to prevent contamination. So, importance po nito is yung ma-prevent po yung exposure to infectious agents and inire-reduce niya po yung risk ng mga laboratory-acquired infections. For example po kami, as a medical technology students, pag nag-experiment po kami is nagsusot po kami ng PPE such as yung gloves, yung goggles, yung face mask, yung laboratory coats or yung mga coats po namin. And nakakatulong po yun para sa safety namin. For example po, sometimes po may mga experiment kami na kailangan ng testing of odor, minsan mabaho, minsan sobrang sharp ng amoy. With the help of face mask po is parang may naamoy po kami pero at least nababawasan po yung pag-inhale namin sa ganong ka-strong na amoy. So next, we have the laboratory ethics and conducts. All personnel must follow a universal laboratory precautions including refraining eating from the lab, securing long hair, avoiding loose clothing, and also observing other ethical and safety practices. Ang importance po nito is para ma-maintain yung mga professionalism, safety, and also yung prevent the contamination of samples. Kami din po as a kapag naglalab po kami, is nire-refrain po namin yung pagdala ng pagkain sa lab. Kasi for example po, nagdala kami ng pagkain sa lab and then nag-conduct kami ng experiment. Pwede po, habang kinakonduct namin yung experiment na yon sa mga chemicals or kung anong reagent man niya napunta dun sa pagkain namin or inumin namin. Pag nakain po namin yon or nainom po namin, pwede kaming magkasakit kasi nalagyan po ng something or nalagyan po ng chemicals yung pagkain namin. Kaya kailangan po natin i-avoid yun para din po sa safety natin. Next, work schedule and work rotation. Example po is medical technologies will rotate through different laboratory sections monthly and adhere to a 40-hour work week schedule, coordinating shifts with colleagues to ensure the coverage. Example po, a medtech is assigned to microbiology this month, tapos ma-rotate po siya sa serology the next month. Importance po nito is yung ma-ensure na yung all staff mag-remain sila as competent in all sections and mag-guarantee po yung continuous laboratory services. Example po, the medtech number 1 is palagi lang po siyang nasa microbiology section, and then one time na ubusan po or kailangan po ng isa pang medtech na mag-perform sa serology. So, kapag hindi po sila naglipat-lipat, hindi po sila magkakaroon ng expertise about sa testing each section. Kaya po naglilipat-lipat po sila. Yung importance po ng paglilipat-lipat po na yan is para magkaroon po sila ng expertise sa mga different sections na kailangan nilang i-test. And ayun, pag nagkaroon po sila ng expertise sa mga testing na yon, nasasanay na sila, may ensure din po yung mga accurate test results. Next, we have the work area cleanliness and organization. Work areas must be kept clean and orderly at all times. Structures, surfaces, and equipment must be disinfected with approved disinfectants before and after use. Example po, yung importance po nito is na-reduce po yung contamination, maintain yung accuracy, and also it prevents the spread of pathogens. Kami po sa lab, before and after po, nagdi-disinfect kami para po yung mga naiwang chemicals ng mga previous na experiment is malilinis namin. Additionally po, yung organization pag nag-experiment kami. For example, nag-experiment po kami, kailangan po namin mag-heat. Nandun po kami sa pinaka-likod, kung saan po malapit yung heating equipment, and also yung mga kung saan mas malapit nga po yung heating equipment, and also yung mga nagwawash or yung sink para mabilis po kaming hugas. And then, kasi po, kapag hindi po sama-sama yung mga equipment na kailangan namin, for example, nandito yung side na kailangan namin for equipment, tapos nandun din yung isa pang side. So, kailangan pa po namin maglakad-lakad. So, nakakakain po siya ng oras. Tapos, parang habang pag naglalakad din, nagkakasalubong kayo, tumatagal po yung experiment, and yung hinihit mo, minsan nakakalimutan kasi may ibang gumagamit din ng mga heating equipments. So, kailangan dapat po may organization din sa pag-experiment sa mga area natin, and yung cleanliness para ma-maintain yung mga accuracy ng mga test results, tapos prevent din po yung mga spread ng mga pathogens, tsaka yung ma-reduce yung mga contamination. Next, we have the chemical and biological safety. All hazardous materials must be handled with care, clear label, and also stored according to safety guidelines. Yung importance po neto, it is to prevent accidental exposure, spills, and also incorrect use of hazardous materials. Example po, a medtech labels the container of hydrochloric acid, and then ini-store niya po to sa chemical cabinet. Yun po, to ensure nga po yung safety nila, at saka para alam po nila kung saan talaga nakalocate yung mga ganong reagents. Kami naman po, sa lab, yung mga toxic reagents, yung mga chemicals, nilalagay po sa fume hood para lessen po yung exposure sa mga toxic sa pag-inhale po sa mga reagents na yon. Nasa pinakalikod po sila nakalagay sa fume hood. Next, we have the waste management and disposal. Chemical hazard must be disposed in a chemical-resistant containers, and biological waste in a biohazard bags. All waste must be neutralized or decontaminated before disposal, and strict segregation of general waste must be observed. Ang important po nito is pinapreserve or pinaprevent niya yung environment sa contamination, and also pinoprotect niya yung mga tao from infectious waste. For example, nag-experiment ka sa test tube, naglagay ka ng iba't ibang mga chemicals, and then suddenly, nabasag yung test tube na yon. Instead of itapon mo siya sa mga sharps container kung saan dapat siya tinapon mo lang siya sa mga regular bins na kung saan tinatapon yung mga kalat-kalat, like plastics, yung mga bote. And what if ngayon kinolek na yon ng mga garbage collector? Kinolek na kinuha nila yon, tas nasugat sila kasi instead of putting nga yung broken test tube sa shards, is nilagay mo lang siya sa mga regular bins. So, nasugat siya, na meron pa rin, may mga chemical pa rin yan, pwede siyang ma-infect and masugat siya doon, tas yung sugat na yun, tas mai-infect. And, pwede pang lumala yung sakit na yon or yung sugat na yon. Kasi sa pagiging pabaya mo, kasi hindi mo alam kung saan na dapat itapon yung mga na dapat isegregate, saan itatapon yung mga dapat itapon. So, kaya dapat alam po natin na yung proper segregation at saka yung waste management and disposal para hindi po tayo makaapekto ng iba. And lastly, we have the personal hygiene. All laboratory personnel must maintain personal hygiene through proper hand washing and sanitation practices. Importance po neto is yung nare-reduce yung risk of cross-contamination between patients, sample, and laboratory personnel. For example, yung medtech po, or kami, after na experiment is nag-wash hands kami thoroughly para after i-remove yung gloves. For example, hindi namin nagawa yon. Hindi kami nag-wash ng hands katapos namin mag-experiment. And then, nakipag-meet kami sa mga other people outside the laboratory. Yung mga chemicals na napunta sa amin, pwede yung magpasa-pasa and pwede yun mapasa sa mga taong nakasalamuhan namin and ma-spread yung chemical na yon or yung mga bacteria na yon, causing the environment in danger and also yung mga tao. So, kailangan po natin ng mga proper hygiene para din sa safety natin and para safe ng environment at ng ibang tao.
The design of the laboratory follows the safety and operational requirements. The facility integrates essential safety features such as a hazard signage, eye wash stations, emergency shower, fire extinguishers, alarms, and sprinkler to ensure immediate response during emergencies. Biological and chemical safety is reinforced through biosafety cabinets, sterile preparation rooms, chemical resistance materials, spill kits, and proper labeling and storage of hazardous substances. A structured ventilation system using general exhaust, fume hoods, negative pressure in hazardous rooms, and positive pressure in clean areas maintains contamination control. Strict waste disposal is implemented through color-coded bins, sharp containers, and isolated waste storage areas, while CCTV surveillance and access control systems strengthen laboratory biosecurity. Operational workflow is guided by the comprehensive SOPs, including the regulated access, contingency plans, continuous staff training, reagent and inventory management, facility and equipment maintenance, twice-yearly calibration, proper record management through the LIS, PPE compliance, ethical conduct, organized work areas, and appropriate handling of chemical and biological hazards. The development of the laboratory is based on institutional and academic references. DOH documents, including the planning and design guidelines, guided the layout and zoning of the facility. Each section of the lab is supported by authoritative sources: the Lung Center of the Philippines for Clinical Microscopy, the Medical College of Wisconsin for Clinical Chemistry, the American Cancer Society for Hematology, the International Society of Blood Transfusion for Immunohematology, the Johns Hopkins Medicine for Immunology and Microbiology. For anatomic pathology, references came from the Royal College of Pathologists and Cleveland Clinic. Safety and facility planning were further supported by the PSA Laboratory Furniture and Stanford Environmental Health and Safety. These academic and institutional resources ensured that each laboratory section followed established standards and evidence-based diagnostic practices. We created the visual representation of the laboratory by using Bloxburg from Roblox to build 3D floor plan and generate a realistic walkthrough of the laboratory layout. This allowed us to simulate room placement, spacing, movement flow, and overall structural design. For 2D representation and label diagrams, we used Ibis Paint, which help us illustrate these sections, pathways, and safety feature clearly and accurately. In summary, Akrivis Laboratory is a private, freestanding tertiary clinical laboratory equipped to deliver comprehensive and specialized diagnostic services. Its structure and workflow are designed to support complex examinations across clinical chemistry, hematology, clinical microscopy, microbiology, immunohematology, immunology serology, and anatomic pathology. The laboratory operates through a clear organizational hierarchy, ensuring efficiency and accountability and quality performance. Safety and quality are upheld through built-in protective features such as biosafety cabinets, emergency equipment, proper ventilation, and waste management, and through strict adherence to standard operating procedure covering staff training, reagent management, equipment maintenance, cleanliness, ethical conduct, and data security. The entire design and functions of the laboratory are grounded in authoritative resources from the DOH and major medical institutions, ensuring the laboratory remains scientifically accurate, operationally sound, and patient-centered. Through its structure, systems, and unwavering commitment to precision, Akrivis Laboratory stands as more than just a diagnostic facility. It is a testament to what science can achieve when accuracy, integrity, and patient-centered care come together. Built on evidence-based design, guided by trusted medical institutions, and upheld by strong safety and quality standards. The laboratory reflects the very meaning of its name, Akrivis, precise and accurate. As we conclude this presentation, we leave you with the essence of Akrivis Laboratory, a place where knowledge becomes a service, where technology strengthens the trust, and where every result reflects the promise of excellence. Thank you.